who is the Director of Services and Resources at FIOSA MIOSA. Now, FIOSA MIOSA is the Food Processing and Manufacturing Health and Safety Organization in British Columbia. They're one of a number of health and safety organizations that are largely industry-centered that have been funded in part through WorkSafe BC over the past number of years, with the principal purpose of working with firms to develop and improve health and safety in British Columbia. We're going to have a bit of a merge presentation. The topic is a little bit different than what I said it would be, but certainly integrates together, because what this presentation is really going to be about is how myself as a researcher is using the idea of benchmarking and leading indicators in terms of measuring health and safety in the workplace with a partner organization who is developing health and safety programs and firms. So the structure of the presentation is I'm going to turn it over to Heinrich for the first half, and he'll give you a bit of a background of what FIOSA MIOSA does, but also what they're doing in terms of health and safety and management programs, and then I'll come up and talk a little bit about how we're working with them in terms of using benchmarking and leading indicators to help improve these programs and evaluate the programs, and then we'll turn it over to you for discussion. So I will thank you very much, Heinrich, and I'll turn it over to you for the next few minutes.
Good. So good afternoon. My name is Heinrich Brooks, and I'm the Director of Services and Resources at FIOSA MIOSA. If I sound a bit funny, and I know I do because if I listen to myself through the audio, I do sound quite funny. It's because I'm an immigrant from South Africa. Been in Canada for about 11 years, 12 years, in February 12 years, and I've worked in Ontario for another health and safety association after I came from South Africa. My academic background, I'm a public health inspector, and I specialized in occupational hygiene in my 4th year. In South Africa, the educational structure is a little bit different from here. I studied at a polytechnical university. So we did a 3-year diploma, a national diploma, and then a 4th year we specialized in a specific field, so I chose occupational hygiene. And that's why my whole story with health and safety all started. So I'm just going to share today what FIOSA MIOSA is. So in 2007, the food processing industry supported the idea of a health and safety association. They had a committee of health and safety coordinators that met on a regular basis, and they've decided that it's a good idea to actually form an association. They went to WorkSafe BC, and through that they got funding to sustain the organization, and that's how it all started. We've got a very simple vision: to become industry leaders in health and safety, and our mission is to foster commitment amongst employers to improve workplace health and safety. Everybody hear me? Good. So let's look at some of the impact that we have, and I know this is obviously not all us, but I think we can certainly take some credit for some of the effort. I know there's many variables. And I wouldn't claim that this is just us, but I could claim probably like a 10% input in this in the overall picture. Now in 2008, the food and beverage industry had a claiming rate index of 7, and then it came down to 6, and it's now at 4. You can see the same sort of trend in manufacturing as well, so it's looking well for us, and that resulted in a savings of about $8 million in claim costs in the food processing and manufacturing industry. In May 2010, because WorkSafe saw the impact that we have on the food processing industry, WorkSafe BC and the Canadian Manufacturers and Exports Association came to us and said, why don't you help us to bring the numbers down in manufacturing as well? So a new organization was born, and we turned from FIOSA to FIOSA MIOSA. And FIOSA simply stands for the Food Industry Occupational Safety Association, and MIOSA is Manufacturing Industry Occupational Safety Association. So it's a combination of the two, and we now serve both of the food processing and manufacturing industry. So that's our logo. Now, one of the key sort of things to one of our flagship programs that we use to bring down the numbers is the Occupational Safety Standard of Excellence. Some of you might know about the CORE program. This is our brand of the CORE program. It's a little bit different from other CORE programs in that we include industry-specific control programs. So it depends on the industry. There's additions to the audit that's very unique and specific to that industry. For instance, in food processing, we will add things like confined space entry, or we'll add things like warmers that might not be relevant in other types of industries. So it's unique in that it includes control programs, where some of the other core programs is purely management system driven, which includes things like accident investigation, workplace inspections, emergency preparedness, and those kind of things. So our program includes all of that, but we also have 14 specific industry control programs. So as you can see, initially it was the core program, and then this was our logo that we used. But because this goes on some food products, it's also the symbol or the logo for kosher. So we ran into some problems there with labeling requirements. So we had to change the look of the logo to the Occupational Safety Standard of Excellence. So we're the only certifying partner in British Columbia for food processors and manufacturers. There are several of the other safety associations offer these programs as well. But that's for construction and forestry and road building and fisheries and so on. So for manufacturing and food processing, we are the certifying partner. So what does the organization have to do to achieve this standard of excellence? You have to go through a formal audit. It's a very strict process, and most of the audit is designed by looking at leading indicators. A very small portion of the audit, I would say, probably 5% of the audit is looking at your performance, at your compliance to rules and regulations when it comes to it. So it's very heavily based on leading indicators. The nice thing about it is organizations can get a 15% rebate on their WorkSafe BC premiums if they pass this audit. So over and above the big premium reductions that they will receive, which can be up to 50% of their premiums to WorkSafe. If you have a bad safety record, say you pay $2 per $100 of payroll for your WorkSafe BC premium. If you do really bad, that $2 might be up as much as $4. If you do really good, it might be up to $1. So it's a four times ratio that you can reduce your premiums from being really bad to being really good. And on top of that, you get this 15% rebate. So it's a very lucrative type of proposition for organizations to participate in. And we see every organization that participates in this program, we see a huge cultural shift because it's based on leading indicators and not lagging indicators. So as you can see, once you achieve that, the first food processor in British Columbia who actually achieved the certification was Lilydale. So they use the logo on their products. So obviously when you have a standard, you have to, as a safety association, you have the responsibility to get people to that standard. And we We have several programs and processes that we use to assist organizations getting there. We have 3 safety advisors that service all of British Columbia. There's one in the Vancouver area, there's one in the Fraser Valley in the interior and up north. And then we have one specific one that only deals with small businesses. Because they speak a different language, they need different services and resources. And we feel that this is very much part of our success. We're really out there helping organizations build safety programs. Then we have several educational tools and resources, lots of fact sheets, resource materials, training programs that we assist organizations with, some of the training courses. Oh, just go back. One of our unique programs is the Made to Measure series, and by which we custom tailor training programs specifically and uniquely to an organization. Once we've been in the field for about 2 or 3 years, we looked at it and we saw that most of the negative comments that we receive around our training courses is that it's not specific enough. We might develop a scenario where an organization might investigate an accident in a winery industry. And we think that's very close to a brewing industry, but people don't like that idea. So if you present a course, it needs to be very specific to their site. So we go out to the site, we take pictures, we use their forms, their policies and procedures to help and train and educate the organization's staff. And that really works well. We also deliver it on their time, because time is of the essence. Whenever there's an excuse, it's not the money, it's the time. It's really difficult to get people off the floor and into a training course. So we deliver these training courses on Sunday afternoons, in the evenings, 20-minute chunks. It's as flexible as they want it to be. We make this courses happen for them. Obviously, that's a huge logistical challenge for us, but looking at the effectiveness of this training versus the effectiveness of just standard sort of boxed or off-the-shelf type of training, it's like chalk and cheese. Way more interaction and way more uptake of information based on our. We do an evaluation 6 months after to see how the organization has actually changed after taking our course. Then we have several online resources like the SOS database, which is basically like a yellow pages for health and safety. There's four sort of big fields. So you go online, you go to this field, and you pick a topic, say for instance WMIS or confined space entry or working at heights or accident investigations. And then there's 4 tabs. In that tabs, you can find things like consultants in that particular area. You can find, and it's all BC based, consultants in that area, trainers in that area, suppliers in that area, or publications. So all the publications that WorkSafe BC has got on that particular topic is categorized in that sort of tool. There's an MSI knowledge base, which is a knowledge base where organizations would upload their own ideas of how they solve the typical problem. So they have a machine, specific like a combi packer, which is like a palletizer machine. And they would look at that and they would solve a particular MSI-related issue with that, an anti-fatigue mat or a lifting device that can help them. And they would post their result online so other people can learn from that. And then there's the safety forum as well, where anybody can basically make use and ask questions. You just go online, you ask the question, and the question gets directed to whichever safety professional within our organization is most skilled in that area, and that person will come back and assist you with it. There's several other programs like Hitting the Spot. That's for organizations that struggle. They really are the ones that need help the most. So we target them and we go knock on their doors and we offer a range of different methods of assistance. Now we're not WorkSafe BC. We don't enforce anything. We're just a resource that make use of us if they want to. We can't enforce anything, but we do help them. The gap analysis is our sort of premier service that we offer, and we go into an organization and we do a complete analysis of all their health and safety policies and procedures based on the type of work and on the site-specific needs. So we do a tour of the premises. We look at that and we bring that into the office and see, does the policies and procedures that they have address all the health and safety concerns that needs to be addressed. And then we help them to build the program afterwards. Once they've gone through this process and they've developed all the recommendations that we made, they would probably pass the RC audit or the core audit. And then we have another program which is called the Synergy Safety Network, which is a program where any organization can participate in and share best policies and procedures. So there's every other month there's a training session. These organizations come together. They enroll for a 2-year period. So there's 12 training sessions. A specific health and safety topic is chosen. There's a training session of 4 hours, and then there's a checklist given to the organizations present by which they analyze their own health and safety program. And then they share, like I have a strong women's program, you have a strong working at heights program, so they share it if it makes sense for them. And then our advisors go out and assist them implementing that program, because every organization is slightly unique, so you need to adapt the programs. One of our newest programs or newest initiatives is the Leading Performance Initiative. As safety professionals, you will hear the following words frequently. You need top management support. That's probably the most universal topic when it comes to safety management. I know I've worked in South Africa, I've worked in Ontario, and I've worked here in different industries, and it's the same story. We need top management support. But as safety professionals, what do we do to educate those senior executives of an organization to do what they're supposed to be doing? There's not a lot of tools out there. As a good research field for you guys would be what's the tools out there to educate the senior leaders of the industry as to their roles and responsibilities, because there's not clear legislation as to exactly what their responsibilities are. How do they influence safety culture? How do they drive safety within their workplace? And it really needs to come from them. So we've decided to develop some tools and resources in that regard. So we've developed a video and a book, a manual, and in this manual there's a challenge that CEOs can take to improve safety culture within the organization. So we wanted a good platform to launch this, and we did this Leading Performance BC Safety Charter, whereby we invite all the leaders within the province, I should say within food processing and manufacturing. Our goal is to have 150 of them sign. That might not sound like a big number, but it's fairly substantial, as there's only about 400 organizations that in BC that would actually, well, in our catchment area that would have a CEO or a corporate head. So it's about a 40%. And the idea is that if that 40% take the lead, the rest will follow, because they will be left behind if they don't. So at the moment, we're sitting at 22. By the end of this year, we want to get to 30. So we have 2 months to have 8 more people signed up. So I'm going to try and play this video now. We had an event at the end of last year, so I'm just trying to show you.
The injury rates in the manufacturing and food processing industries in BC are more than double the average for all BC industries. A group of committed individuals decided to do something about this unacceptable statistic. A health and safety charter for BC backed by the leaders of industry and manufacturing. The journey began when the steering committee at FIOSA made plans for a conference like no other before it. A conference of CEOs and senior executives who will lead BC's food processors and manufacturers in creating BC's first health and safety charter. On October 27th, the Leading Performance Leadership Conference was held at the Terminal City Club in downtown Vancouver. FIOSA Chair Derek Weens opened the conference by issuing a challenge. We are here to make a difference. We are here not only to make our own companies healthier and safer places to work, but to take our industry with us. Over the next 4 years, we intend to have a minimum of 150 signatures on the Health and Safety Leadership Charter we are releasing today. WorkSafe BC's President and CEO, Dave Anderson, was the first to sign the charter and spoke of the importance of reducing injury rates in BC. Paul Henning, Vice President of Rio Tinto Alcan, spoke passionately about the need for CEOs to create a corporate culture of health and safety and lead by example. Ryan Keith, a partner in Dowling's Toronto, made the legal case for safety and helped delegates understand their responsibilities under Bill C-45. Jason Myers, President and CEO, Canadian Manufacturers and Exporters, told delegates that the business case for safety was well established, and that world bottom-line growth can and is being achieved by companies across the country. A panel discussion made up of Ben Hume, CEO of Alco Ventures Inc. in Langley, Paul Boileau, Director of Operations Soprano Inc. in Chilliwack, and Derek Campbell, General Manager Gate Gourmet at YVR, created a large amount of discussion about the financial benefits of core certification and some of the challenges when creating a culture of safety. Howard Behar, the former president of Starbucks Coffee, provided an inspiring keynote address about the importance of people over profits and provided examples of the ways in which that philosophy helped Starbucks to climb to the top of the retail beverage world. Moderator Catherine Gressinger then introduced the Charter and led a discussion of the principles behind the Charter and a roundtable examination with the delegates about how to move forward from here. After further discussion, the Charter was endorsed by 23 CEOs and senior executives from across BC, and Lisa McGuire, CEO of Fiosa Miosa, addressed the conference on the challenge ahead. Lisa McGuire told the delegates, "We are making the first step on the journey to 2015. You have helped start the journey by being here, and those of you who sign the Charter today can rest assured your commitment is recognized, not only by those here today, but by your customers, your employees, and your communities. Because of you, we now have BC's first Health and Safety Leadership Charter." "Now," says McGuire, "it is up to us to build that culture of health and safety and grow our business communities within BC. The way forward is perhaps even more important than the giant step taken last October. While those who signed the Charter are trailblazers, the momentum must be kept up. We need to bring more CEOs and senior executives along with us on this journey." A CEO strategy towards our goal of 150 signatories by 2015 will be developed by the 23 inaugural signatories. A strategic planning session has been organized in February to develop the strategy which will shape the future for the next 3 years. The challenges facing industry and business in BC won't be resolved overnight, but as we have demonstrated, it starts at the top. Now we must ensure that our efforts are harnessed to achieve our goal, a healthier, safer BC. To get involved or to sign the Charter, please get in touch with us at 604-858-9979 or visit us at fmiosa.com.
It's on again? Okay, so the mission of this charter is to engage senior executives in becoming corporate leaders where health and safety are valued as critical elements of their business. The importance of this is that the steering committee have decided on this mission and vision, not us as their safety association. So it comes from themselves. So they've got automatic buy-in. And then the vision is to have all BC business leaders and their organizations adopt the mission of this health and safety charter. So at that meeting, the video was referring to, we formed a steering council of 5 members, and we developed a 3-year action plan, and one of the key components of that action plan was for us to develop key performance indicators for the initiative so that we can decide if it's successful or not. And as you can see there, on November 29th of this year, we will have a roundtable, which is a follow-up by which we hope to get that extra signatures for this year and to promote the initiative a little bit more. As you can see there, it's going to be at the Terminal City Club, and Duncan Hawthorne from Bruce Power is going to be our keynote speaker. So the reason why that was just the background. The reason why I'm here today is to learn a little bit about how we use leading indicators. So the first thing is you have to place yourself in the CEO's shoes. Typically, health and safety is a negative measurement. Like you measure bad things that happen. So in the CEO's mind, he's looking for high numbers, like big profits, high efficiency, and so on and so forth. So when we swap that sort of idea around, it really doesn't fit well. So for that reason alone, using lagging indicators is not a very good measure. So how is health and safety typically measured? Anybody want to give me an idea? One of the lagging indicators that we typically use. Injury rate? Yeah, lost time, injury rates, lost days, and so on and so forth. The problem is that leads them to believe that it's a cost of doing business. Right? They think it's, okay, we're going to have works FBC premiums, we have to fix the forklift that fell off the loading dock, we have to retrain stuff. So to them it's always going to be a cost of doing business as long as you use lagging indicators. They will never see it as a business opportunity. They will never see it as a mechanism by which they can actually improve the performance of the organization from a financial aspect. But we can change that as safety professionals. So we're all saying what gets measured gets done. Putting a measure on something is tantamount to getting it done. It focuses management's attention on that area. Information simply is made available and people respond to it. So we have to measure. So the problems with traditional health and safety management, injury rates has got no indication of potential severity. If you fall today, you twist your ankle. If you fall tomorrow, you hit your head and you're dead. It's the same problem. The same mistake has been made. You cannot see that from lagging indicators. So we have a need for leading indicators. A low injury rate leads to not enough data to be available to make any changes to your program. If an organization goes 3 years, 5 years, and there's 3 injuries in that 5 years, what are you going to do with that data? You need enough data to make substantial changes to your program. Underreporting. If people know that these numbers are important, they're going to start to hide it. We've seen it time and time again. Oftentimes organizations look really well on paper, but what's happening on the floor is a total different picture. So another thing that gets addressed if you change from lagging indicators to leading indicators. Fraudulent injuries skews health and safety performance. If you get a claim that's not really a claim, that's reflected on your record, but that doesn't make you a bad employer. Right? So you need to address that for other measures, but that's why it doesn't give you an accurate measure of how well you're actually doing, because fraudulent claims will happen. A low injury rate leads to complacency. How many times have we seen major organizations having catastrophes? I remember there was a mine in South Africa who went 5 years without a single injury. 5 years without an injury in a mine. Think about that. 5 years and then a tunnel collapsed, 30 people died in one shot. So they had complacency. Right? They did not use the correct indicator to drive their safety program. Injury statistics only reflect outcomes and not causes. You can learn nothing by numbers. You need to look at your management system and how your management system functions. And then there's a large number of near misses, as you know, versus accidents. So you've got a multitude of opportunity to improve safety performance if you look at your near misses. So how would you measure safety, the most important factor is don't just measure something because it can be measured. A lot of people make that mistake. They see something and they say, oh, we'll measure that. You need to have a specific purpose and goal with what you measure. Measured activities, and it has resource implications. In other words, if you want to measure something, somebody's going to measure that. So it takes time and effort and cost to measure it. So don't waste time on irrelevant measures. There's no single reliable measure of health and safety performance. There's not one thing that you can look at and say, because we're doing this well, we're going to have good health and safety performance. In Chris's presentation, they had 8 questions that touched on various aspects of health and safety management, and you need all of those to get an accurate picture of health and safety performance. If you take 1 or 2 of them away, you don't get a good picture. And you have to use you don't have to use a microscope approach, but a telescope approach. The wider your aim, the bigger the picture that you look at, the more factors you consider when measuring health and safety, the more accurate your picture is. And guess what? You also get more opportunity for improvement. The more factors you consider, the more things there are that you can build actions around to improve. If you try to focus, if you try to pinpoint the single cause, typically you miss a lot. So what do we measure? We have to look at both leading indicators and lagging indicators. You cannot just use one. I know I've bashed lagging indicators, but they are important. The whole idea is to find a good balance of to what extent are you going to look at leading indicators and what extent are you going to look at lagging indicators. And you need both to get the complete picture. The requirements of an effective health and safety measurement indicators, it must be accepted and meaningful to be effective. Effective, sure, there's a typo there. It must be simple and understandable and repeatable. Okay, don't develop a vague thing that's based on somebody's gut feel. It must be quantifiable. You need to be able to put a number to it. You need to be capable of showing trends. So if it's something that happens now and then that's interesting, but it's not frequent enough that you can see a trend, it's no use. It must be unambiguous to define an objective. So you must be able to define what you want to measure. It must be cost effective in terms of data collection. It must be timely, and it must be sensitive enough to show change. Some measures are so vague and so broad in scope that even if there's a lot of change in the organization, it's not reflected in that measurement. So you need to make sure that your measurements will be affected by the things that's changing on the floor. Occupational health and safety measurement implementation strategy. So if you want to develop a strategy to implement these measurements, establish a baseline. You need to know where you want to start. Establish specific targets and goals for these. Where do you want to see this in a year, in 2 years, and so on. Assign responsibility for collecting and analyzing the data. Compare actual performance against set targets. Develop corrective actions. And evaluate the established measurements and mechanisms. This is probably one of the things that most organizations don't do well. They sort of go this route, but they think they set once they've developed those targets. They don't really look at how effective their measurements are. So you always have to tweak and adapt your measurements based on things that change on the floor. Like my science teacher in university used to say, he said, think it might be a new experience. So okay, so now the leading performance initiative, as you can recall from the previous presentation, we've taken this whole idea of leading indicators to industry, and we want them to drive the numbers down. So it's facilitated by us. It's driven by a CEO steering committee. And there's 2 forms of measurement that we've assigned for this particular initiative. And the one is internal, that we administer. And then we're working on a partnership with UBC to do it on a sort of a higher level to get the bigger picture. So these are the 6 areas that we've defined. There's 5 there. We're missing one. There's the 5 areas that we've defined to use in this initiative to establish if it's effective or not. The involvement level of all hierarchical levels in the organization. So we want to see to what extent is all the levels within the organization involved in health and safety. We want to look at the existing risk levels. We want to look at safety performance, and this is the part where the lagging indicator still plays a role. Safety compliance, that's to what extent workers follow safety rules. And then mutual trust and the workplace model is the last one. The one that's missing from there, there's 6. The one that's missing from there is leadership and commitment. We want to measure to what extent does leadership actually drive the safety performance. And I don't know how that fell off the map there. So the external measurement that we've set for this organization is hopefully going to be done through Chris and his team. It's intended to complete the big picture. It's the measurement of the initiative as a whole. So it's not looking at the individual organizations, but as the initiative on a whole, compared to BC, compared to Canada on a national level, maybe compared to the world to that extent, because we need to understand to what extent this is effective, and it's not just a social improvement of safety performance in general. So we want to make sure that we do it from an academic standpoint properly. And this is based on 8 predetermined questions. And those are that 8 questions. I won't go into, I know I've got a bit of history because it was developed in Ontario in partnership with UBC, so I won't go into the details of how these questions came about, but it's quite a big task. I think it took 9 months, something like that, to come up with these 8 questions to be leading indicators for organizations when it comes to health and safety performance. But I'll let Chris speak to that. And then this is the elements of the OSCE program, or the core program that I spoke to you earlier about. So it's leadership and commitment, hazard ID and control. There's this element of industry-specific control programs. That's broken up into 14 sub-elements. Workplace inspections, accident investigations, training and instruction, program admin, joint health and safety, emergency preparedness, and stay at work, return to work. As you can see, all of this is much more easily quantifiable by leading indicators, not lagging indicators. It's very difficult to have a lagging indicator on to what extent management is committed. But you can do it through leading indicators. By how often do they have meetings with their staff around things. So these are all leading indicators. Same with hazard ID and control. What's the processes in place? To what extent does the reports come in, and so on and so forth. So as you can see, the whole program is really built on leading indicators, except for program admin, where you look at your lagging indicators to see how you should tweak your program to improve. And that's my bit. Any questions? Okay, thanks. Okay, Chris, back to you.
Thank you. Is this on? Great. Thank you very much, Heinrich. So I've been starting to work with Heinrich and Fiosa Miosa over the past couple of years. They approached myself as well as colleagues at the Institute for Work and Health about a year ago, with the question of, we're investing significantly in the certificate of recognition and the OC programs. We have this new leadership performance initiative, but what we really are interested in is some guidance and external assistance in terms of evaluating these programs. I mean, there are some very strong claims made about the performance of and the potential for these to improve health and safety in British Columbia. And to Fiosa and Miosa's credit, they are looking for that type of objective external evaluation. So I do have a presentation. We kind of developed our presentations in isolation, but I'm not going to actually spend much time on my presentation because I actually want to turn it over to you. So I'm only going to show you 2 slides because Heinrich has actually done a pretty nice job of covering most of the things. In fact, I have to say that even though they came to myself as sort of the academic expert, I think so far in this relationship I've been learning more about occupational health and safety than they have been for me, but perhaps I'll be able to contribute something at some point. So I'm going to go back to, and this is going to completely cause you conniption, Sheila, because I'm going to show 2 slides of 23, and one's going to be at the front and one's going to be at the end. So I apologize. The 8 questions. So that's slide 10, if in my slide deck. So in conjunction with the Institute for Work and Health, and in particular Ben Amick, who is their Associate Scientific Director and Senior Scientist, they worked with a number of health and safety associations in Ontario to come up with a short form instrument that could be used on an ongoing basis. So there's a lot of science in terms of leading indicators, and some very good work has been done in terms of validating some of these questions and creating quite detailed audit and survey instruments that have been shown to have good sort of psychometric properties at the firm level in terms of measuring occupational health and safety and safety performance in terms of injury rates. But as Heinrich pointed out, those are pretty expensive, significant respondent burden. If you want to develop an instrument that's going to be used by a large group of firms and employees, that could be used with quite a number of respondents within a firm, you need to come up with a fairly short form instrument. So these are the 8 questions, and these are the 8 questions that we're going to be using in British Columbia to help evaluate some of the initiatives that FIOSA and MIOSA have developed. They were developed with input by health and safety associations. So these are the types of questions. So to some senses, it's not being driven by the science in terms of what we think as researchers should be measured, but what do they think should be measured. And so the folks in Ontario have done some pilot work in terms of validating these 8 questions. And now I'm going to flip through to a number of slides, and I'll tell you which one it is, Sheila. This one here. Essentially, a measurement was done, and firms were classified. This was about a survey of about 900 firms. Were classified based on how well they did in those 8 questions, and there were 4 tiers developed. Those that did very well. In fact, they said that they had done most of them. This would be down here, and then those that had progressively worked. And so the instrument seems to correlate very well. It is emphasizing what Heinrich talked about in terms of capturing performance on the ground that is happening, that could be correlated or predictive of a future injury event. So in terms of so what we're doing with these 8 questions is we're working with FIOSA MIOSA to develop an evaluation protocol to do some pilot prospective evaluation work with the firms who are entering into their leading performance initiative program. And we're still in discussion in terms of how we're going to develop the evaluation protocol, but essentially what we're hoping to do is use this, the leading indicator tool, the 8 questions, to survey both firms that are entering into the LPI program, but also similar firms that aren't, and then follow these firms prospectively over a number of years to not only look at how they may change on the leading indicators, but also in terms of their health and safety. It's I think a very exciting project because it's a prospective project. Most often when we're asked to evaluate these types of programs by WorkSafe BC or by other organizations, we're invited at halfway through or at the end of a program, and in fact it can be quite challenging then to do an evaluation. So I do have a number of other slides, but I am cognizant of the time, and so I'm sure that you probably have a lot of questions, mostly for Heinrich. So I will turn it over to the moderators to take questions for the last 10-15 minutes. So thank you very much for your attention.
So thank you both. It's an idea that I hadn't thought of before, so it's really interesting to hear about it. I'm curious about who will answer the questions that you're proposing. Is it the management, everyone in the firm, random selection?
So that's a great question. On slide 16, we cover that. But so the pilot work that has been done to date, they selected both management and worker representatives to answer the audit, the eight questions, and they did find that they tended to correlate quite well. And so, what we'll likely want to do when we go through with our pilot evaluation is also to survey both management as well as worker or labor representatives within the firm. And one of the things that we'll be looking at doing is seeing how well those answers do correspond to one another. Within the firm, that's a good question. Whether or not it can be random. I mean, some of these firms are quite small, so you would, if you're doing management, you probably wouldn't be random, but you may be able to come up with ways of selecting different workers or different occupations or capacities within a firm. But again, that's something that we haven't thought through because we're really much still in preliminary discussions about how we would operationalize the evaluation.
If I can just add to that, the first sort of cycle of measurements will probably only start by the end of 2014, because it will take a bit of time for us to ramp up that numbers to the 150. At the moment, there's only 23 signatories, so it's really not enough to start the process. So we want to get a strong number, probably close to 100 before we would actually start to get baselines and things like that.
Thanks very much. I'd like to hear a little bit more about the role of the Joint Health and Safety Committee. Also, is your industry heavily unionized, and is the union active in health and safety? Can you say something in that regard?
Yeah, as you can recall from my slides there in the RC program, one of the elements that we do evaluate as well is to what extent is the Joint Health and Safety Committee effective. So that is recognized as a fundamental part of our health and safety program, and a well-functioning health and safety committee. If your committee is functioning well, your program will probably be a good program as well. So yes, there's unions. There's also some union members on FEOSA board, because you need to hear all points. You need to look at it from all different perspectives.
Well, I'm curious about the original 26 signatories and the 150 that you're aiming for. What is there a size? Is there, is there anything that would characterize those as being in a particular, number of employees or profit margin, or is there anything that links them?
Well, the whole idea is that the organization should be large enough so that the role of a CEO can really be harnessed. If the organization is fairly small, like 15 or 12 or so on, it's really hard for us to impact to a large extent. So we're looking at larger organizations, probably 20 plus. But we're not going to point anybody away. Like if a small organization come to us that want to participate, they're more than welcome to. One of our newest people who indicated that they will sign on this on 29th of November is Turn Creek, which is a small winery in the Okanagan, and they only have 23 people on staff, but they do extremely good work when it comes to health and safety. They became OSIS or core certified within about 5-6 months. The initial thoughts was when we first went to see them, it's going to be about a 2-year process for them to get certified. But they really they throw all the efforts into it, and they achieved much better than what we thought. So small and they roll that out to their peers as well, other wineries in the area. They invite them to conferences, so they're uplifting the whole of the winery industry. So by all means, a small organization is welcoming the initiative.
Online question. It's from Peter Griffin, and he wants to know how the answers to the 8 questions are confirmed for their accuracy.
So is he asking whether or not they're actually measuring what they say they're measuring, or whether or not there's like respondent bias in the questions? So I mean, they are self-reported. One of the things that is being done in Ontario is the 8 questions are used in conjunction with a number of other instruments and survey questions, audit instruments that have been validated in other research contexts, and they do show that they have pretty good correlation and construct validity. But that's implicit in that question is it is self-report information, and there is the potential for bias in self-report. And this is one of the balance between developing an instrument or going in and doing an assessment, which FIOSA does in a very small number of firms. But what we're trying to do is we're trying to develop an instrument that is valid, having shown that it does correlate well with some of these more in-depth audit instruments and inspection, but can be used quite quickly across a large number of firms in context, and perhaps even be used multiple times in the course of the year. I answered his question.
Not the other? Well, like I said, we see the Joint Health and Safety Committee's efficiency and effectiveness as part of our health and safety program. You need to involve them with policy development, with evaluation of the program, with development of procedures and so on and so forth. So it's one of the measures that we do include in our Certificate of Recognition program. And we feel that without an effective Joint Health and Safety Committee, your program will probably not succeed.
Thanks for that, Chris and Heinrich. I had, Heinrich, sort of a more specific question when it came to your second presentation from FIMOSA. And I really liked the way you presented the need when you're talking to upper management about health and safety, that you have to be proactive about it and be positive about it. And I was wondering if you had any other thoughts for us when dealing with upper management, the way to get more commitment from them in terms of being young professionals in the field.
Good. Very good question. I think to get their attention, you have to start to talk bottom line. And we've seen that almost every world-class organization also have a world-class safety program. You simply don't find an organization that's really not performing well when it comes to health and safety. So there's a in that video resource that we have available for senior executives, which Ed Rodenberg, which is the CEO of Lilydale, the first company that got certified in our program in BC, he made a statement and he said that safety comes at a price. If you do it well, your cost goes down. If you do it bad, your cost goes up. And that's sort of the philosophy that you need to make sure that your CEO understands.
actually have a question for both of you, because I would like to tie it together. And I'm familiar with the audit processes that are used, and I'm willing to accept that the research is showing you've got 8 questions that are leading. How close are we to being able to structure our audits to reflect the 8 leading indicators?
Not close. It's a very interesting question. That has been kicked around the table a little bit, but no final sort of ideas. The whole audit process is driven through the standards and guidelines that WorkSafeB sets for these programs. So we'll have to bring it to that table to discuss any changes to the audit format. Yeah, that's what it is. But the idea is alive, make no mistake.
No, I think your question is an excellent question. The simple answer is that we're at the very beginning of this. So yes, I've made claims that these 8 questions work well in British Columbia, but we don't actually know the answer to that question, to be honest with you. We're at the I emphasize that what we're talking about today is pilot work in British Columbia. We're at the beginning of thinking about how we can evaluate and objectively show that these audit tools, certification programs actually are making a difference in terms of health and safety. What we're hoping to do over the next number of years is to not only to demonstrate or investigate and test whether or not some of the tools that have been developed work, but also, provide some information and insight into, what parts of the audit programs or the certificate of recognition program actually does work in terms of predicting health and safety behavior. So, I would say that any of the claims that I've made today should be taken as preliminary and hypothesis driven. Now, having said that, we are working with researchers in other jurisdictions where they're a little further ahead in terms of some of the evaluation of these types of tools. So, we're not going into this uninformed or blindly, but hopefully in a number of years we'll be able to talk with a greater level of confidence in terms of research and studies that have actually been done in British Columbia, and actually may be able to shed some light in terms of what works and what can be improved. So I think I'll just jump in and thank Heinrich for a really great presentation. It's not very often you'll see me turn the floor over to someone else for the entire period of time, but there you have in fact seen it. So the only final thing I would probably sort of just say to the students is that FIOSA has a lot of programs, and they're fairly active in an industry of a high injury rate, so they may not be a bad organization to approach if you're thinking of an interesting practicum. They may have a place for you. And with that, I'll thank you for your attendance and the great questions. So thank you very much, and thanks, Heinrich.